Hello everyone, welcome to our second video on Introduction to Human Anatomy. In this video, we'll talk about the anatomical position and directional terms. So when we talk about the anatomical position, we're going to describe the position of the body in the anatomical position, and we're going to describe the differences when the body is in the prone and supine positions. Then we'll use the directional terms to describe position of human body structures relative to other structures. So first is the anatomical position. The anatomical position is a visual reference point of the human body, and you have to have this. Let's say you're having a conversation with someone and you don't have the patient that you're talking about in the room, or you're having a conversation over the phone with somebody very far away. You guys need to have whoever you're having the conversation with need to have a common reference point. You can't assume that your patient is lying face up while the person you're talking to is assuming the person is lying face down. You need to have these terms so that everybody is essentially on the same page and sort of seeing the same thing. Okay? So a person in the anatomical position is standing erect with feet flat on the ground, toes pointing forward, and eyes facing forward. Their palms are facing forward and their thumbs are pointed away from the body. So you can see this person here standing in the anatomical position, and you can see that this is kind of not like, like a typical resting way of standing. So keep that in mind, particularly the arms, right? The arms are kind of out to the sides, palms facing forward, not, at your sides kind of thing. So recognize this and be able to describe it. The other thing that's going to be kind of important over and over again is when you're talking about left and right. So like if I were to say left eye versus right eye, right? When you look at this person, and I say left eye, which eye am I talking about? Which left side am I talking about? Mine as the observers or his as the patient's? So whenever we're talking about left versus right in anatomy, we're always going to assume it's the patient's right and left side. So it will be this guy's right side or this guy's left side. Never mine, unless I'm oriented the same way as him. Okay? But it's always the patient's right and left, never your own. Okay? Now next is going to be prone and supine. So these are going to be basically lying down anatomical positions. So supine is lying down in the anatomical position face up, and prone is lying down in the anatomical position face down. Okay? Next are going to be directional terms. So directional terms are used to describe the position of one anatomical structure relative to another. Directional term statements are usually is blank to statements like the wrist is blank to the elbow. The directional term in the blank would describe how those structures are related to each other. Okay? So you're going to have superior, inferior, anterior, posterior, medial, lateral, superficial, deep, ipsilateral, and contralateral. I'm noticing proximal distal is not on this list, but in proximal distal as well. Okay? All right, so let's start with superior, inferior. So superior means closer to the top of the body. Now, there's going to be another term in humans that will be interchangeable with superior. That will be what's called cranial, because cranial technically means closer to the head. Now, the reason that these are superior and cranial are interchangeable in humans is because we walk on two legs, not on four legs. Okay? So because we walk on two legs, superior and cranial kind of mean the same thing. Now, I have to warn you that that's not always the case. If you're an organism that walks on four legs like a cat, cranial and superior are not going to be the same thing. Right? And we'll talk about what is. Right? So also you'll see in your notes here that I give you some examples. So for the head is superior to the abdomen or the head is cranial to the abdomen. Either way is the correct way of saying it. Next is inferior. Inferior means closer to the bottom or to the feet. Okay? Now again, there's another term that is interchangeable with inferior in humans, that's caudal. Now, this means closer to the tail, like the tail of the torso, like think your tailbone. Okay? Um, and again, this is only because we walk on two legs. If you were like a four-legged animal, like a cat, then caudal and inferior are actually not the same thing. Okay? So example here, the neck is inferior to the head, right? The neck is here, the head is up here. So the neck is closer to the bottom, it's inferior to the head. Okay? Next directional terms are anterior and posterior. So anterior means closer to the front. Now, again, in humans, because we walk on two legs, anterior and ventral mean the same thing. So ventral actually means closer to the belly, which again, because we walk on two legs, is our front. But recognize that if you were a cat, um, you're walking on four legs, your ventral surface, your belly surface, would actually be inferior. So in four-legged animals, ventral and inferior are interchangeable. But because we're standing up straight like this, anterior and ventral are interchangeable for us. Okay? Um, so examples would be the chest is anterior to the shoulder blades, right, which would be back here. Now I'm trying to use very general terms that you would understand, at this point. But recognize, we're going to be using more anatomical terms later, and we're not going to say shoulder blades or anything like that. Okay. So you could also say ventral. The chest is ventral to the shoulder blades. Next is posterior. Posterior means closer to the back. Now, this is, in humans, this is interchangeable with dorsal. Dorsal technically means closer to the spine, which again, because we walk on two legs, is our posterior side. That's where our spine is. But recognize, if I were a cat, I were walking on four legs, dorsal would actually be the same thing as superior, right? When you pet a cat, you're petting the cat essentially on its spine, on its superior or dorsal surface, right? So notice that, when you walk on four legs, it's different. But in humans, posterior and dorsal are interchangeable. You can use them, either one of them, right? For example, the occipital bone is posterior to the frontal bone. Now, I don't expect you guys to know this one. I was trying to find a good example. But your occipital bone is this bone that basically makes up the back of your skull here, and your frontal bone is what makes up the forehead. So like this area is your frontal bone right here. So this occipital bone back here is posterior to your frontal bone, which would be here. Next is going to be the terms medial and lateral. Now for both of these, you need a reference. So the reference is going to be a line, forgive me if this is not straight, a straight line that goes down the middle of the body like this. Okay, so that straight line that goes down the middle of the body, that line is called midline. Okay, now medial lateral uh, basically refers to how close or far away from a structure, from that midline a structure is. So medial, notice, is right on the midline. Medial means closer to midline. Lateral means the opposite. Notice it's way over here. Lateral means further from this midline. Okay? So example for medial is the nose. The nose, right, because it's right on midline, is medial to the eyes, which are just a little bit further away from that midline than the nose is, right? Example for lateral is the ears. The ears, which are out here, are lateral to the eyes, which are in here, right? These eyes are closer to midline, the ears are further from midline, so the ears are lateral to the eyes. Next are the directional terms proximal, distal. Sorry to include them earlier, but here they are, and you can see them in the image. So proximal, distal are going to be really unique directional terms. Proximal, distal are directional terms specifically used when describing structures on limbs, like your arms and legs. So you use proximal, distal on arms and legs, and also in tubes. So like your digestive tube. Technically, your digestive tract is a tube that runs through the middle of your body from mouth to anus. So like the inside of that tube is actually the outside of the body. So kind of imagine a hollow tube that runs through your body like that. Okay, so technically the inside of this tube is the outside of the body. And so when you're describing, the position of the mouth and the esophagus, right, you're going to use proximal distal. Okay? So the reason that you do this is because limbs and tubes have a beginning and an end. So like a tube has a beginning here and an end here. Limbs have a beginning, which is their attachment site. Okay, so like your shoulder right here. Okay? So that's why you use proximal distal, because you're basically, proximal means like closer to the beginning or closer to the attachment site. Distal means further from the beginning or further from the attachment site. Okay? So proximal, like a limb example, would be the elbow. The elbow is proximal to the wrist because this elbow here is closer to the shoulder, which is your attachment site, than the wrist is. So it's proximal, closer to the beginning, closer to the attachment. For a tube, the mouth is proximal to the esophagus, which is going to be in your neck here. Okay? So that, because the mouth is basically at the beginning, right? That is the beginning, and the esophagus is further from the beginning. So the mouth is closer to the beginning. It's proximal. Distal, like I said, means further from the attachment site or further from the beginning. So limb example for distal. Sorry about that. So limb example for distal would be the ankle is distal to the knee. So for the leg, the attachment site is your hip here, right? So the ankle is further from that attachment than the knee is, so the ankle is distal. Okay? For tube example, you would say the stomach is distal to the esophagus. So the esophagus is here, right? Your stomach is down in here. So the stomach is further from the beginning, which is the mouth, than the esophagus is. So it's distal. Now, just a quick note on proximal distal, particularly when you're dealing with limbs, right? If I said the ankle is blank to the knee, some of you might be tempted to say inferior, right? You might be saying, oh, this is inferior to this. And that's technically not wrong, but it is more correct to use proximal distal whenever you can on limbs and tubes. So the more correct answer would be the ankle is distal to the knee. That would be more correct than saying the ankle is inferior to the knee. You always use proximal distal on limbs and tubes over anything else whenever that's possible. Next directional terms are superficial and deep. So superficial means closer to the surface. So an example is your skin. Skin is superficial to muscle, right? Because muscle is right underneath your skin. Skin is right at the surface. Deep means further from the surface. So another example for that one would be bone is deep to muscle. So like especially in your arms, right? You have skin, muscle, bone. So bone would be deep to the muscle and muscle would be deep to the skin. Or you could say skin is superficial to muscle or muscle is superficial to bone, right? You could say it in any of those ways. The last set of directional terms are ipsilateral and contralateral. These basically refer to structures that are either on the same side or opposite sides of the body. Contralateral means structures that are on opposite sides of the body. So the example I gave you is the right knee and the left knee. So the right knee is contralateral to the left knee because they're on opposite sides of the body. Okay? Ipsilateral means structures that are on the same side of the body. So the example I gave you is the right knee and the right ankle, right? So the right knee is ipsilateral to the right ankle because they're on the same side of the body. All right, so just some quick questions here. The nose is blank to the ear. Okay? Nose is blank to the ear. So nose, the best answer I think is medial, right? The nose is right on midline, the ear is further from midline. I mean, technically, you could say anterior. You could say the nose is a little bit in front of the ears, but I think the best answer is medial. Right? Next is your knuckles are blank to the wrist. Okay, so remember, we're dealing with a limb here, right, with an upper limb. So knuckles to the wrist. Knuckles are closer to the end, so they would be distal to the wrist. Okay? Next, the chest is blank to the abdomen. So the chest is above the abdomen, right? The chest is superior to the abdomen. And then next is the liver is blank to the skin. So liver is an internal organ, right? So the liver is going to be deep to the skin, right? Because it's further in the tissue. It's deeper in the tissue. Or deeper, excuse me, deeper in the body than skin. Right? Skin's always superficial. This is what's right on the surface.